Well, thank you both for coming. And we wanted to thank the Rockland Public Library for co-hosting and co-sponsoring and hosting the event. And we're going to focus on just COVID updates, recent updates for COVID prevention and treatment. And we'll try to answer all your questions. The information in this presentation was up to date as of October 31st. So we know it changes quickly, but as of October 31st, this was all up to date. We're hoping that this is going to be interactive. And so before we start, we wanted to just tell you a little bit about ourselves. I'm Melissa Carr. I'm a pharmacist at PharmD Internal Medicine. We don't have any financial interests or relationships to disclose.
And my name is Chandler Blodgett. I'm also a pharmacist, and I'm the manager of our outpatient pharmacy at PharmD Medical Center.
And so we're just going to start with a quiz. Do you know how to protect yourself from COVID? Do you guys have
Do we have to raise our hand? Or
You can just shout it out.
You can go first.
Oh, no, go ahead. Well, I don't think my mask does any good anymore, but I wear it all the time when I go out in public. I still, well, I'm in a job where I have to wear gloves, but I wash my hands a lot. And that's good. Your turn.
Yeah.
Same.
You know?
Yeah.
Perfect. Yes.
So these are some things you can do to protect yourself at all community transmission levels. So in addition to washing your hands, you can get a vaccine, stay up to date with your vaccine, improve ventilation if you're going to be inside, get tested for COVID if you think you might need to, follow the recommendations for if you've been exposed, stay home if you're symptomatic or suspect you might have been exposed to COVID, seek treatment if you're at high risk for getting very sick if you are positive for COVID, and avoid contact with people who have or suspect they have COVID. All right.
Oh, yes. And I'm vaccinated and boosted.
Perfect. Love to hear that.
I forgot that part.
And so you guys can shout out any questions you have as we go. So the vaccines are a very good protection for us. They help our body develop protection against the virus that causes COVID-19, and even though you can still get infected, they help you lower your risk for getting very sick and being hospitalized and dying. The CDC still recommends that everybody who's eligible stay up to date with their immunizations, and these are just some resources where you can go and find vaccines in your area. So there's different ways you can find them if you're looking for them. Chandler's going to talk to us about the new bivalent booster.
Yeah, so with our COVID vaccines, we do require these booster doses, and that's necessary because over time, the protection from these doses, from our vaccines, decreases. And there is a new bivalent booster, which is recommended for all patients 5 years of age and older, finish their primary vaccine series, and spend at least 2 months since their last COVID vaccine. So regardless of your primary series or a booster, you should wait at least 2 months before getting this new bivalent booster. So regardless of the previous boosters you've had, the indication is to get this new bivalent booster. It's very similar to our previous vaccine. It still has protection against the original virus, but it also has our Omicron BA4 and BA5 subvariants, which are currently circulating. Side effect profile is very similar to our monovalent vaccines, or our previous vaccines. As far as recommendations, if you are at high risk of severe disease, I certainly recommend getting this booster promptly. However, if you're a lower risk patient, otherwise healthy, if you've had a recent COVID infection, it is okay to wait. After a COVID infection, it's okay to wait about 3 months before you get this new booster. And some experts are suggesting a sweet spot between 3 and 6 months after your last COVID vaccine dose or infection to really maximize the benefit from this most recent booster.
That's if you've had COVID, if you just had it recently.
Correct. the natural immunity that would have developed from an infection kind of makes it not as important, not as necessary to get that booster right away. And spacing it out actually may be more advantageous, so the effects of that booster will be prolonged for the months after you have received that booster dose.
Can you mix and match, like?
That's a great question. Yes. So if these booster doses are mRNA vaccines. Pfizer and Moderna are the two manufacturers of the mRNA. The CDC does not differentiate or have a recommendation of one over the other. If you've had a Moderna series, it's okay to continue with Moderna or switch over to a Pfizer vaccine, and vice versa. So it's certainly okay to mix and match. Some people have immunocompromising conditions, so even if they've received a vaccine, they may not get sufficient response. And there are some individuals who cannot get vaccines because of severe contraindications or allergic reactions to components of these vaccines. There is a medication available for individuals in that category called Evusheld, which is used as a preventative measure, a pre-exposure prophylaxis medication. And there's a type of medication called a monoclonal antibody, which is dosed every 6 months, so long as it continues to be appropriate and the risk for COVID infection continues to be high in our communities. Any questions so far?
Yeah, I do actually. I don't know if I'm really immunocompromised, but I do have something that affects my, it's my thyroid,
So that's a great question. So what would be considered an immunocompromising condition? It's great to confirm with your PCP. The low thyroid levels would not actually be considered an immunocompromising condition. So you are able to mount a sufficient immune response with these vaccines. So certainly I would recommend getting this bivalent booster if you do fall into that. It's been 2 months since your last vaccine. But this Evusheld would not in your situation.
Typically, it's for people that have had like an organ transplant, or they're on medications that prevent rejecting an organ transplant, something that's suppressing your immune system intentionally, like medications, things like that.
well, mine's autoimmune.
Okay.
Mine's an autoimmune disease, so my body's suppressing it.
Yeah, so there are some autoimmune diseases where you can get the Evusheld if your doctor thinks it's appropriate.
And certainly some medications used to treat these autoimmune disorders can lower your immune response and your immune function. In that case, vaccination is paramount, very important. And then the conversation regarding this Evusheld is generally reserved for a very severe, immunocompromising conditions. But not a bad idea to bring it up with your PCP.
So, I'm sorry, I got a little lost in your mask. So with the autoimmune, or whatever I'm taking for it, it doesn't really matter. Am I getting the effect of the vaccine?
Certain medicines, and probably this would be a great venue to discuss, medications that you're taking for privacy reasons. Certain medicines can decrease your immune functioning, kind of depress your immune responses, and that increases your risk for infections and decreases the how well these vaccines work. And it's kind of there's a spectrum. I think in most cases, staying up to date with the most recent vaccine series and their boosters elicits sufficient protection.
There are specific algorithms that we follow to decide whether or not you're eligible for that Evusheld. So it would depend, what exactly your condition is and what medication you're on. And the algorithm keeps getting updated too as well. And they
But certainly after the presentation, I'd love we can talk more and kind of show you the algorithm. We can have a more in-depth discussion about that. maybe not such a crowded venue.
One live cast on YouTube.
Yeah, exactly.
All right, do you have any questions?
No, I'm good.
All right, so next quiz. Do you know when you should take a test?
It's your turn.
When you experience symptoms,
Any other times?
Or if you've been exposed.
2 to 3 days after symptoms.
Close. So if you, immediately, if you have any symptoms, you should test. And then if you've been exposed, you actually wanna wait 5 days before you test. And if you test negative after that 5 days, you could even consider testing a day or two after that too to make sure that it's still negative. And you could consider testing before an indoor gathering, especially if you're gonna be around people that have an immunocompromising condition or like young people that aren't eligible for the vaccine. So you could consider testing right before those events if you wanna be safe. These are some symptoms, you guys probably already know this, so I'm not gonna read them off, but typically symptoms appear 2 to 14 days after you've been exposed to the virus, and anyone can have symptoms that range from mild to severe. And this is just some ways you can get an at-home test. We have some here for you to take home for free today. They can be purchased at the drugstore. As of January 15th, people with private insurance can get reimbursed for up to 8 test kits a month per covered individual. Main Care members can get a free test at any pharmacy that participates in Main Care. They just need to go to the pharmacy checkout instead of the regular checkout. Free at-home tests are available at most federally qualified health centers, and then there is Maine residents are also eligible for 5 at-home free test kits through the Department of Health and Human Services partnership with the Rockefeller Foundation. And if you have some test kits at home and they're expired, they may not really be expired. So after they distributed them, they continued to collect data, and they found that a lot of the test kits are actually good for 12 to 18 months beyond what they originally thought. So the government did develop a website that you can go to and check to see if the expiration date on your test kit has been extended. And you just need to put in the lot number from your home test kit to check to see if it's been extended, and then you can use it to the new expiration date, so don't throw them away without checking.
Well, if they are, how do you throw them away? Where do they go?
They just go in the garbage.
They do?
It's fine just to throw them in regular trash.
So some of them have like little packets that change color to tell you if they're still good or not, and some of them you can just go to this website and see if they're still usable. But you can throw all the pieces away in the regular garbage. So what to do if you get a negative test result? So if it's negative, that means that the test didn't detect the virus. Doesn't necessarily mean that you're not infected, just means that there wasn't enough virus for the test to detect. So if you have symptoms, you might want to take precautions and recheck in a couple days. If the symptoms worsen, you'd want to let your provider know. If you don't have any symptoms and you've been exposed to somebody, again, consider retesting and take precautions. If you don't have symptoms and you haven't been exposed, you can just return to your normal activity. If you get a positive test, that means that the test did detect the virus and you have an infection. So you should make sure you're taking precaution, including wearing a high quality mask. Make sure you tell anybody that you've been around that they could have been exposed. Monitor for symptoms and emergency warning signs, and consider letting your healthcare provider know if you think you have a condition that puts you at high risk for severe infection. And the next slide is just showing you what the emergency warning signs are in case you weren't aware. So trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale gray or blue colored skin, lips, or nail beds, and any symptoms that are severe or concerning to you, and you would want to call 911 in any of those cases. These, I'm sure you already know that there's certain factors that raise your risk for getting very sick from COVID. The CDC says anyone that's over the age of 50 is higher risk, and your risk increases as your age increases. Anybody with immunocompromised or weakened immune system, unvaccinated for COVID, or any of the underlying health conditions listed there. Alright, so most people just get mild symptoms that will last for a few days, usually feel better after a week, and the treatment is just aimed at relieving your symptoms to keep you comfortable. Most people can recover at home without any medical care. They just want to use over-the-counter medications that can help with either fever or pain. We recommend you get plenty of rest and drink plenty of fluids. Any questions before we, oops, I skipped a slide. Before we move on to the treatments? Okay.
So there are treatments available for individuals that may be more at risk for this severe disease progression. In the outpatient setting, we recommend treatment for symptomatic adults, so people who are experiencing some mild to moderate symptoms and are at increased risk for progressing to a more severe disease. So we kind of talked about that. There's certain immunocompromising conditions, age, and some certain comorbidities, vaccination status, so those who have not yet been vaccinated are at increased risk for a severe infection. Our COVID-19 specific therapies include both antivirals and monoclonal antibodies. Of note, anyone over age 65 would be considered a candidate for COVID treatment that we have available now.
And you have to have had a positive test. It can be an at-home test, but
Very important. Speaking towards the different treatment options, they're all listed on the left here. Our mainstay of treatment, which I'll focus mainly on, is Paxlovid, probably a drug that we're probably familiar with. This is a very effective oral medication that's taken over the course of 5 days. Timing is very important. And this is a medication that you want to take within 5 days of symptom onset. With Paxlovid, there are quite substantial drug interactions, so it's not a bad idea to kind of have this conversation with your provider in anticipation or in preparation for a potential COVID-19 infection, to verify if you are a candidate for this medication and to go over your medication list. Because likely, if you take prescription medications, there may be medications that have to either be modified with a dosage adjustment or discontinued for the duration of that 5-day duration, and even for several days after. If Paxlovid is not appropriate due to generally drug interactions, we generally move on to our monoclonal antibody, bebtelovimab. The advantage being that it is a single one-dose, one-day infusion, IV injection. And remdesivir is an antiviral therapy. Again, if Paxlovid or bebtelovimab are not available or not appropriate, we move on to that treatment option. So I think what is very reassuring at this point in the pandemic is that we have preventative measures and we do have treatment options for individuals that are at risk for more severe disease progression that are effective. Rebound Paxlovid is a phenomenon that may occur between 2 and 8 days after you've completed your course of Paxlovid. So Paxlovid is, again, very effective at reducing the severity of an infection, of an illness, and reducing the risk for hospitalization and death. There is a phenomenon that has been found to occur in some individuals where symptoms reoccur several days after the resolution of their symptoms, and even after testing negative on an at-home test. These recurrent symptoms are mild and still do not outweigh the benefits of that initial therapy. And consistent with our CDC guidance, it's not necessary to retreat with Paxlovid should you get rebound. I think it's very important to note, and that's for the most general individuals, that's kind of the mainstay of our guiding decision making at this point. That pretty much wraps up our treatment options, our preventative measures, our vaccine updates. So what questions do we have?
I don't think I have any.
I'm all set.
All right, well, that's wonderful.
Alright.
And here's our reference list, and certainly we'd be happy to talk more in depth about any topics that we touched base on during this presentation. All right, well, thank you guys so much.
Yeah, thank you.
Great job.
Yeah, thank you.